Hello, everybody. Myself, Dr. Nivedita Telang, and the title of my leadership project is Improving Maternal and Child Health in Indian Tribal Women. Before I begin, a brief introduction about myself. I'm an anesthesiologist by qualification from the Mumbai University with over 20 years of experience in the pharmaceutical medical affairs roles. I head the medical and regulatory at Sanofi Consumer Healthcare India Limited and have also been involved in various medical affairs activities of multinational organizations like MSD, J&J, and GSK, to name a few. To talk about my leadership project, the main problem statement is because India experiences high rate of maternal and infant mortality and morbidity, particularly in the tribal areas. And there have been various reasons for this high rate, mainly because of lack of adherence to, good practices during antenatal and postnatal care, limited access to nutritional diet. The women's health is generally neglected in these areas because of the double burden of domestic and professional labor, lack of accessible and well-equipped medical facilities, and also because of extreme poverty, geographical location, and suboptimal infrastructure. So the purpose of the project is to basically foster change and improve maternal and child healthcare outcomes in these tribal regions. There is a need for comprehensive maternal care initiatives which will strengthen the antenatal and postnatal care, provide nutritional guidance, and also enhance the access to these medical facilities to the tribal women. So, trained healthcare facility professionals, including skilled birth attendants, need to be provided in these areas. And the public healthcare sector needs to be redesigned so as to include monetary and non-monetary incentives to encourage the healthcare workers and physicians to work in these tribal areas. The overall objective is to provide policy inputs for gender empowerment and improve the maternal and childcare outcomes in tribal areas, and therefore to have strategic and long-term policy and program framework. Also to provide advice and encourage partnerships between key stakeholders and international and national think tanks, educational and policy research institutions. The implementation plan basically consists of an advisory board who would comprise of senior women leaders of various NGOs and associations of public and private sectors like the Niti Aayog and Saathi, to name a few. This ad board will evaluate the evolving policy and strategic guidelines pertaining to maternal and child health outcomes, engage with Ministry of Health to examine what are the gaps in the current policy and how to suggest appropriate modifications or mid-course corrections. They will analyze and provide comments on various such programs and also conduct research. The major task, therefore, is to have a one-to-one interaction with the leaders from the NGOs and understand gaps in the current implementation of maternal and child health in the tribal areas. Then form an advisory board group to brainstorm on the current policy and identify gaps. Develop an action plan with the help of the group. Finalize a policy to be presented to the Ministry of Health and seek an endorsement from the Ministry of Health on the revised policy and engage technology partners to help disseminate the policy. This program has therefore enabled me to demonstrate the 4 leadership traits, namely first, authentic, because the outcome of this project are not aligned to any objective of the organization that I work for, but it is purely based on the unmet need and the passion that I have. It is inclusive and helps me demonstrate this leadership trait because it involves collaboration with different stakeholders. Strategic leadership mindset is demonstrated with the help, because it has pushed me to design and apply the implementation plan, decide who the stakeholders would be, and align them to the objectives of the program. And also impactful leadership style, because the success of the project will depend on the overall impact created through the strategic interventions. The execution plan will therefore be needed to be looked upon with precision to be able to meet the expectations laid down at the start of the program. Thank you for your patient learning, for your time to listen to the project. Have a great day.